Hi, morning everyone.
Hey Lou, you're wearing your mask. That's good.
Always wearing my mask.
Yeah.
Just rather be safe than sorry.
Yeah.
And look after
Social
ourselves.
distancing, 1 meter. If you don't sleep in someone's bed, not up close and personal. Let's not drop the ball. Let's make South Africa a great country. Top of the pops around the fact that we don't have massive third waves, because we're very grateful that our government hasn't fully locked us down. So let's take that privilege and behave like responsible adults and clean. Get your vaslapi in the taxis. If you don't have access to sanitizer, if you don't have access to a mask, wear a beanie or a buff or a scarf. It's about people spitting in your faces. Okay, keep your social distancing. Let's not do parties, meet and greets for people for dinner, drinks, etc. Let's just be responsible. Think about those who are at risk. Yeah.
I mean, my hands have seen more alcohol than my body has in my lifetime.
Okay, good one. Okay.
So, Carol, we want to go back to some of the unusual breast cancers, the things that we don't normally see or are 1 in every 100 sort of patients. What are they?
Well, I think the ones that we don't think are a cancer, so then maybe we don't notice it, so we don't do anything about it. So the first one that springs to mind is the concept of Paget's disease. So what happens is you get a little excoriation on the nipple. Now we must remember the areola is the brown disc around the nipple, and the nipple's the little, in some of us, sticky out bits, in some of us, sticky in bits, the central bit. Okay, we don't squeeze our nipples. Okay, they can produce fluids and substances. If you get changes, almost like scaling on the areola, and it's itchy, it's often eczema. But if you are worried, you come and see your friendly doctor. And if people give you a quick and short and it's okay answer, then it needs to be followed by investigations. Now, Paget's is when you get a little excoriation, so it looks like a little scab on the top of the nipple, and it slowly gets bigger, and the cancer spills from the nipple over onto the areola. Now it's interesting because oftentimes the mammogram and ultrasound is normal. So this is one of those diseases that you have an often delay to diagnosis. So you probably, if you're worried, want to see someone who has a special interest in breast health. And sometimes what we need to do is a little punch biopsy on the skin of that nipple to diagnose it. Very important, because it sits there lazily on the top, but slowly over time, like anything, it has the potential to invade. All Paget's are HER2 positive. Never see one that's not. Yeah.
Oh wow, that's interesting.
When they are at DCIS, sleeping phase, the treatment is surgical. When they have spread, obviously that it needs some form of HER2 treatment. Okay.
You learn something new every day.
There we go. Okay, next one. Inflammatory breast cancers. Yes. Again. So this is when the breast presents as a red hot inflamed breast, and it can be quite subtle. So there are different types of inflammatory breast cancers. I often sit with the students and they battle around it. Sometimes their cancers have been there for a long time, and you've got lots of nodal disease, lots of glands. Okay, you get this almost secondary inflammation, edema on the breast. And easy way is you see the difference when the patient lies down, you get less of that redness as opposed to when they sit up. Now, Paget, and I love the way, so you know I'm French Duolingoing, so the secret is how do we keep ourselves entertained and off the social media of the fear around SARS-CoV? Find something to do. So, je parle un peu français now. Okay, so the word is peau d'orange, okay, orange peel effect on the breast, and often with inflammatory cancers you see this, but you can sometimes just see a slight pink-red tinge. So anyone who presents with a pink-red tinge to the breast, they get sonars or mammograms depending on their age, you see a thickening in the skin, okay? There are other causes, cardiac patients can get it, but you need to have a high index of suspicion to making sure that it's not a cancer, and sometimes doing a biopsy. Young people who have what they think is a mastitis, okay? So we've always got to have that. An inflammatory breast cancer is one of our differentials. The treatment of an inflammatory breast cancer is not starting with surgery. The lady once who surgeon told me that he'd successfully taken it all out, the entire inflammatory cancer and 22 glands. You can hit your first search on Google that says inflammatory breast cancer. The treatment is primary oncology treatment, then surgery. It's probably one of the few times that we have to do a mastectomy. We do have ways of doing some form of reconstructive procedures in this scenario, particularly in this unit, and they all need radiation. So let's not miss inflammatory breast cancer.
You were saying that there's a thickening of the skin. So if you're doing self-breast examinations, would you actually feel that? Or would it be more medical?
Sometimes not. What you've got to do is, that's why I always say, look at your breasts in the mirror, look at your body in the mirror. Horrific as we get older, we know this, but do it. And lift your arms to the side, and you're looking for differences between one side and another. I think kind of knowing your norm is a concept that we talk about often when we talk together. If it's your norm, that's fine, but if things change, you need to make sure that you have a sensible explanation for it.
Okay.
So let's look at other unusual cancers. So I think we would always have to mention that in youngsters who present with what we think is a fibroadenoma of the breast, in a small subset, it can be a triple negative breast cancer. So we need to be aware of that, and that it feels like a fibroadenoma, but it's not. That's why you always do a sonar, and if someone's not doing a biopsy, a 3-month follow-up, anything that grows a core. There are other conditions that we see that are not technically breast cancers. Youngsters with sarcomas in the breast, youngsters with aggressive Phyllodes tumors in the breast, in fact in people in all different ages. So we must be aware that what we are being is sensible in terms of history examination, good radiology, and again I want to mention that there's no such thing as an emergency biopsy, and you don't need a surgical biopsy, because we know the cost of radiology and core biopsies, and I always say to people, go and speak to somebody and work out what all the options are. Sometimes we can get them done in the government sector, sometimes we can work out special ways to do them, but do not rush into surgery to find out what something is. In fact, do not rush in, full stop. Okay, breast disease is not an aneurysm. Okay, we want to understand what things are in a sensible manner, and taking time is important. So other unusual things is when people present with glands in their armpit, and that's why I always say, when you examine your armpits, relax your hand at the side. When you go for your sonar, they lift your arm out, pulls the structures up, but your ability to feel is really hard. So any form of relaxed movement, so you can have a good scrop and a dig and feel gently, is important. But if you do feel glands, we sometimes see hard to see, and it's uncommon to get what we call an unknown primary where we can't find it. We still sometimes do, but often hard to find primary, so they're presenting with glands, or things such as lymphomas and other conditions. So I think I've covered 3 or 4. Is there anything that you can think of that people talk to you about? Non-cancer cancers, skin cancers on the breast?
Not that I can think of at the moment, but that's something we can look into as well.
Absolutely. You know what I would like is, I would like from people, now I've never watched one of these. I did get from Byron that if you take a picture at the wrong angle, I look hideously old, but you know what, over 50, so what, eh? Okay.
Well, you have a plastic surgeon on speed dial.
Well, I don't think I'm going to use him for anything, okay? Not because I don't love him, but quite frankly, less is more when it comes to surgery, okay?
Yeah,
okay.
definitely.
Accept ourselves as we are, okay? Say something nice. You don't look so old, okay?
Not at all.
Okay. And I think what I would like is people to ask if they've got questions, if they want us to discuss. That's very important for me. Okay.
Okay. So send your questions in on Facebook, and we will address them in one of our next Benn Bits.
Okay.
Thanks, Carol.
Okay, pleasure.